Peen going to give you pus, worms, parasites, and cancer, part 14. How do we check for LGV? It says that the diagnosis can be made only with LGV-specific molecular testing, PCR-based genotyping. And these tests can differentiate from the LGV, blah, blah, blah. However, these tests are not widely available, and the results are not typically available in a time frame that would make clinical management, that would influence clinical management. You mean the tests are not available? Therefore, the tests are based on suspicion, epidemiologic information, and I guess if your doctor is sensitive enough, knowledgeable enough, and thoughtful enough to kind of put the pieces of the puzzle together, they're going to look at the symptomatic, autonomic site, right? They're going to look for that stuff. They're going to look for the exclusion of other etiologies for proctocolitis. They're going to kind of make a educated guess based on some of your symptoms. So you have to be able to describe what's going on with you very, very well, because again, they only go by what you tell them. Oral or rectal ulcers, genital or oral lesions, rectal specimens, lymph node specimens. They got to look for all these things if you are symptomatic. If you're asymptomatic or you only have a few or maybe not all of these, it's going to be difficult to diagnose. So technically, if you have or you do appear to have proctocolitis, they're going to test you for chlamydia, which we discussed in a previous part of the series. And, by that point, you would have had severe symptoms, more than likely, for you to know that you have proctocolitis, including bloody discharge, tenesmus, which is the feeling to want to take a do, but your bowels are empty. You're going to have rectal ulcers, and, with the rectal stains, they're going to take a test and see if you have proctocolitis and kind of make a deduction from that. However, it says that the persons who do actually get through this rigmarole of testing and is diagnosed with LGV, they should also be tested for other STIs, especially HIV, gonorrhea, and syphilis. The big HIV is coming next. Stay tuned.